Ruth Maguire, followed by Michelle Ballantyne.
Presiding Officer, too many friends, family and neighbours have been lost to unavoidable early death caused by substance misuse. The reality is that problematic drug and alcohol use is something that we're all impacted by, and it's in all our interests to work together to prevent and reduce harm and to support recovery. 38 lives were lost in North Ayrshire in 2018. It's expected that that will be higher in 2019. So I'm going to focus my remarks on drug death today. No one person, no one government, no one organisation, no single intervention can end this tragedy of preventable, avoidable death. And it is a tragedy. The question is rightly asked if this number of accidental deaths, accidental poisonings, were being caused by something else, if our collective response would be quicker, would be better. In the actions that we are taking, we need to ask that question of ourselves. We need to ask that question of our governments, our IJBs, our ADBs, DPs and our health boards. If we're serious, and I believe colleagues in the Chamber are, about the lives of those at risk, we must show by our actions, as well as our words, that they're important lives, that they're people worth saving. What Scotland faces in terms of drug deaths is an emergency, and I welcome the Scottish Government's acknowledgement of that and their recognition that more can and must be done to help improve the quality and provision of service that we already have. To save lives, to prevent avoidable deaths, we must meet people where they are. We must treat all individuals with dignity, compassion and respect and without judgment. Do everything in our power to make things safer, using policy and practice that we have evidence works. Harm reduction is important. Yesterday, I was pleased to welcome the announcement from the Scottish Government that the Drugs Death Task Force will support a 3-month trial providing 500 naloxone kits to the Scottish Ambulance Service. The Scottish Ambulance Service already responds to many potential fatal opioid overdoses by directly administering naloxone to reverse the overdose and save a life. This additional step with the take-home kits is very positive. 514 naloxone kits were handed out in North Ayrshire in 2019, and it was reported that 45 lives had been saved. North Ayrshire Council is now training additional community development staff to administer the life-saving drug, action that should be commended. I'd like to thank Scottish families affected by alcohol and drugs, not just for the good work that they do, but for their briefing. And I add my voice in support of the asks of their family reference groups. They consider naloxone to be a critical part of saving lives and ask that all workers coming into contact with individuals at risk should carry naloxone and be trained in its use. I agree. Police, fire, ambulance, housing, homelessness workers, primary care and pharmacy services are all well placed to save lives. Now, I do understand the reticence that some non-healthcare workers may have felt previously that naloxone had to be injected, and I can understand why that would cause concern. However, there's now a nasal application which I hope removes that barrier. Those tasked with protecting lives in Scotland can also be lifesavers. Now, whilst I recognise the need for local flexibility and community solutions, I also concur with the ask that any postcode lottery and provision is removed. If housing officers in Ayrshire can save lives administering naloxone, and they have, those skills, procedures and processes should be replicated across Scotland. The sharing of knowledge, skills and best practice is essential. If drop-in access and same-day prescribing as an option can be offered in one part of the country and it works, it absolutely should be replicated. It should not be easier to buy dangerous street drugs than it is to get safe treatment. A truly person-centred treatment will meet people where they are, recognise the barriers that are in their way and remove them. Same-day flexible drop-in appointments along with scheduled appointments seems sensible. We must recognise that systems and processes that work fine for one group can actually disadvantage others. Presiding Officer, my party and others have rightly made much of the damage that punitive sanction regimes in the benefit system exact on people, so I was utterly horrified to learn that they may form part of the system of drug treatment. These should be stopped immediately. Withdrawal of treatment for missing an appointment is outrageous. It does not sound person-centred, and that's me being kind. It is not empowering, kind, compassionate or respectful. I know the Minister has these values himself, so I would ask in closing that he shares what action he'll take to end the practice of punitive sanctions in drug treatment. Presiding Officer, lives are being saved and services are being delivered right now by kind, compassionate professional workers who share our pain and distress at rising deaths. And importantly, we also have people in our communities who are in recovery right now, who are supporting their peers with hope and purpose in their lives. Let's listen to them, let's learn, but most importantly, act with urgency and immediately make the changes that we know will save lives, lives worth saving.